Okay, so disclaimer coming from someone who works in healthcare and in the ICU. The flu this year, I swear to God, is different. It's hitting different. I'm gonna combine shift. I think I'm on 17 and 18 now. I'm going to combine those shift together because I work back to back. Both of my patients were intubated and sedated because they came in with the flu. And honestly, for the hospital that I work in, we have been seeing a surge of patients coming in with the flu. And quite frankly, I'm more scared to get the flu this year than COVID. And if you haven't gotten your flu shot this year, go get your flu shot. Don't mess around because I don't want to be taking care of you in the ICU. But basically, both my patients were ventilated, sedated because they went into ARDS. So one of my patients, she came in with the flu, but she also had COPD exacerbation. So it was just like two lung diseases working together to like cause her to need to be ventilated. So she was ventilated on the first day, and then we wanted to kind of do a SBT trial on her the next day. So we kept her on the vent. I kept her comfortable on the first day. I came back on the second day. She successfully passed the SBT trial and the SAT trial. We were about to extubate her, but then she went into AFib RVR. So we had to call the doctor, and she has a history of AFib. So, they didn't want to do the amnio drip. They didn't want to do an EKG. All they did was ordered IV push metoprolol, which then controlled her heart rate. After that, we were able to successfully extubate her. And then we placed her on BiPAP for a little bit, then transitioned her to a nasal cannula, which she uses at home anyways. After that, she was downgraded, and then that was it for her. My other patient, he was admitted for the flu, and he was going between high flow nasal cannula, maxed out, and BiPAP. He did not want to be intubated. It's not like he refused to be intubated, but he just was trying to delay that step as much as possible. So he's maxed out on high flow, saturating 90%. He's very tachypnic, very dyspneic. I think that's how you say it. He just overall did not look good. It looked like he was drowning, even though he's surrounded and breathing in air. So that's how he was for the past 2 days. Overall, it was a very good 2 shift. I just got a little bit more practice with ventilator settings and a RDS protocol, and just learned a little bit more about respiratory and lung compliance. So yeah, those were my 2 last shifts of this week. Otherwise, I have 1 day off tomorrow, and then I'm back for 3 in a row. So pray for me. Bye.